Dr. Arianne here. Today I'm going to talk about chronic pain. This is such an important topic, and it is something that is completely mismanaged in America, and I think honestly misunderstood. So let's first start talking about what is pain. So after I took this course through the Institute of Functional Medicine this week, we were talking about energy and mitochondria and the energy of our cell, and they've referred to pain as a disordered and disorganized energy, and disorganized energy is the foundation of disease. So pain is also classified as a unpleasant sensory or emotional experience associated with actual or potential tissue damage. So that means that we could think that there is potential tissue damage, and that can create a pain response. So in terms of statistics, we have greater than 25 million Americans that report experiencing daily pain for greater than 3 months, which means that that is considered chronic pain. Definition is longer than 3 months. The National Academy of Medicine states that pain affects more than 100 million Americans per year, and the associated costs are estimated to be $600 billion per year, which is completely driving our healthcare costs up. So if you're wondering why that's happening, and specifically low back pain, which I did a separate video on. So the types of pain, we have nociceptor, which is a sensory receptor in our peripheral nervous system that is going to encode and transduce some type of noxious stimuli, some type of painful stimuli. We have hyperalgesia, which is a condition where a person develops an increased sensitivity to pain. So where it might not provoke a pain response in one person, it provokes a significant pain response in another person. We have neuropathic pain, which is pain caused by a lesion or disease of the somatosensory system. We have allodynia, which is due to a stimulus that does not normally provoke pain. So this could be something where you might be brushed up against with your hand or an arm, and that can create a pain response. And then we have sensitization. So that is an increased responsiveness of the nociceptive neurons to the normal input, and it can also cause an excitation response. So it's an abnormal or high alert response. We have lots of different characteristics of pain. It could be muscle and joint pain, it could be myofascial pain, it could be visceral pain, it could be a neurodegenerative decline, it could be post-surgical, cancer, chemo related, it can be emotional pain. So let's not forget about one of the key drivers to pain. So when we have chronic pain, however, it is thought to be a result in a change in the nerve pathways between the tissue, or we can say the brain and the spinal cord. So it is altered in a chronic pain patient, which is why chronic pain is now classified as a neurodegenerative disease, just like Parkinson's and MS and Alzheimer's. It is considered a neurodegenerative disease. And we want to think of chronic pain as it's possibly ongoing nociception. So there's constant noxious stimuli to the nervous system. It's a change in the brain process of how we interpret the pain. And there's also a failure of the descending inhibitory pathways. So we have this two-way communication, two-way streets. So we have information coming up, information going down. So with pain, we want to be able to inhibit the pain, to quiet it down, turn the volume down. And unfortunately, that is also altered in a chronic pain state. So what causes chronic pain? We can have peripheral and central sensitization. So that again is where where our nervous system is on high alert. We have ongoing nociception. We have descending pathways, which I just spoke about. We have adaptive movement disorders. So that means that we begin to adapt and compensate our movement patterns, which attributes to structural and integrity changes in the body, which further can enhance pain. We have chronic stress, PTSD, adrenal activation. So that is a huge driver of chronic pain. Can't say that enough. Adverse child events has been linked to chronic pain. So that could be early childhood trauma at any level or some type of adverse childhood event. Opioids, which I'll get into in just a second, and chronic inflammation. So I've talked about this lots, but you can have acute inflammation that can turn into systemic inflammation, and then you can eventually have chronic, which turns into a loss of tolerance. When you have a loss of tolerance, then you have inflammation all over your body and are not able to manage your immune system, your neurological system, your circulatory system well. Essentially, with chronic pain, the volume is dialed up too high, right? And we're not able to dial it down. That's the issue. So it's dialed up too high, but there's not the ability in the nervous system to be able to dial it down. So some of the things that are associated, some common clinical findings can be fatigue, insomnia, irritable bowel syndrome, interstitial cystitis, neuroendocrine disorders, depression and anxiety, PTSD, OCD, brain fog, idiopathic low back pain, headaches, migraines, TMJ, facial pain. It could be in men and women, and there could be genetic influences. And as it relates to opioids, what is the one thing that everyone gets when they have chronic pain? Opioids. However, that has only been shown to be 30% marginally effective, 30% have a fair response, and up to 50% fail to respond or have side effects and therefore discontinued. And up to 125 deaths per day from opioid use have been associated with overdosing. So it is not the solution. And in fact, chronic opioid use can cause more, i.e. increased pain over time, because it's affecting these neural pathways. So it is not the solution. There are lots of different networks of imbalances that happen with chronic pain, everything from neuromusculoskeletal, metabolic, related to the actual membrane potentials of the cells, biochemical, as well as modifiable lifestyle factors, sleep and relaxation, exercise and movement, social relationships, nutrition. All of those things are things that we can modify. Mental, emotional, spiritual is that we have to heal the suffering of why someone is experiencing this significant amount of pain in their life. So lastly is, what can you do about chronic pain? So it is not going to injections and constant surgeries and passive type treatments. It is not opioids. What has been associated with improving chronic pain is mindfulness. So mindfulness-based stress reduction programs have been extremely effective. Physical therapy and movement. So making sure that someone is really moving towards a healthier lifestyle. Also nutrition, so specifically more of a plan that focuses on the mitochondria of the cell, the energy of the cell. Healthy fats specifically are a really key highlight to work on membrane stabilization. Using the 5R approach that I spoke about in a separate video for gut restoration. If there's gut issues, there's a very good chance that you could be experiencing pain. When you think about movement, purposeful movement, mindful movement, not over-exercising, not high-intensity training programs, you need to walk very slowly. You need to really tiptoe your way into true purposeful movement that feels good for your body, and you're managing how do you feel afterwards. So I walk for 5 minutes, I feel great. I walk for 20 minutes, I feel crappy. Well, then you know what? You gotta go back to 5. You have to walk slowly. Your body can't respond that quickly when it's in this type of chronic pain state. It's really, really important. Self-regulating tools such as breath awareness. So breath is one of the most powerful things, I call it your superpower, that can inhibit pain, that can tune you into your body, that can take you out of autopilot. Any type of biofeedback, using heart rate variability, which I also spoke about before, meditation and prayer, and again, we talked about mindfulness, and potentially psychotherapy, psychology, anything that seems to work for you to be able, especially cognitive behavioral therapy, especially something that helps you to move away from the chronic pain, from the past, and move you forward to a healthier, optimal lifestyle. I think it's important to understand the science of it, which is why I briefly touched on that today. But I think the most important part is to be able to recognize that what it is pain is information. And when I think of the patient that I'm working with that has that, I'm thinking, how can I get them to lead their best life? how can we introduce better sleep habits, better nutrition, better breathing, and you know, better social relationships, less stress in their life, so that their pain does not become their story, right? So we write our own stories, and when you have chronic pain, if you're experiencing this, know that you can rewrite the story. You just have to go slowly, and you have to go purposefully, but you can do it. I hope this helps. I hope you have a great day. Thank you.